Welcome to Dementia Unpacked. For many families, the word hospice brings fear, but it's often one of the most compassionate parts of the dementia journey. Today, we are joined by Dr. Penny from Greendale House to talk about what hospice really means, how it supports both families and patients, and why comfort and dignity matters until the very end. Dr. Penny is a palliative care social worker whose career began at Soweto Hospice. She completed her master's in social work at Northwest University in 2014 and went on to present her innovative work at local and international palliative care conferences. Now based at Greendale House Palliative and Hospice Care Center, she continues to contribute to the field through her published articles in the Association of Palliative Care Centers of South Africa and the International Journal of Psychopsychology Palliative Care Issues. Welcome, Dr. Penny.
Thank you so much for inviting
welcome so
me.
much. I'll also say, please give us the lovely opportunity of you introducing yourself and the work that you do.
Oh, thank you so much for the opportunity. You know what, you have covered almost everything, but I must add that I started to work as a palliative care social worker in 2010, meaning it's 15 years now, if I'm not mistaken. I started working as a pediatric palliative care social worker, then moved to adult palliative care. So I'm well vested with both pediatrics and also adult palliative care. Thank you.
Perfect. So when I contacted Greendale for some assistance, I didn't know that you were going to be the person that is going to be here today. So when you sent me a message saying that you actually remember me and you remember my father, I was very, very set aback. I was so shocked. But at the same time, I was like, it was meant to be because I like this is full circle,
Yeah.
and you're meeting me in much calmer situation or much calmer waters rather.
I must say I'm happy to be here with you, and I've seen you are continuing with educating people out there
Yeah.
about dementia. So I said, why not? Let me come. Let us just sit down. Let us talk about this. It's so much important. People need to know.
That is correct. That is correct. Well, with that being said, I'll get straight into it. As you may know, many people think hospice is only called when all hope is lost. Can you please help us understand what hospice care actually is and when families should consider it?
Yo, thank you so much. That question is so much important. I think let us start here by educating people what hospice care is and what palliative care is. Many people are called by the doctors at the hospitals and they are told that, there's nothing that we can do about your family member. Take them to hospice. And hospice, I will start by explaining what hospice care is. Hospice care is when we are now working with the end of life, is towards the end of life, when there is no treatment that is going to happen. When I'm talking about treatment, I'm talking, let's say a person is going through chemo, radiation, or whatever. So when they say to you, now we are referring you for hospice care, it means there's no active treatment that is going to be to help and to be done. Now it's all about comfort and keeping a person pain free and all that. So palliative care, ideally, it should start from diagnosis. When a person is diagnosed with, let's say, dementia, because this is the topic that we are dealing with now, or any life-limiting or life-threatening illness, then palliative care needs to begin. The care team needs to walk the journey with your family and also with the patient.
Yeah.
And, with palliative care, that's when you have to, you get the chance to deal with the, advanced directives. Check if the wheels are in place. work with the families and see, plan with the patient. Because when now it comes to hospice care, what if they refer you for hospice care and you find that the patient is no longer able to verbalize what their wishes are? And as a family now, you are finding this space whereby you have to decide now for your loved one to say, oh, now we think that my mother should appreciate, was going to appreciate, we think. But if we have started with you from diagnosis and walked this journey with you until we come to hospice care, all of these other issues will have been sorted. As the family members, you'll be knowing what's coming, what's happening. Unlike you come to hospice care, you are confused. Sometimes, you know what, even the explanation is not there.
Doesn't make sense. Yes.
You are just being called and said, no, there's nothing that we can do anymore, hospice. And, it's so shocking. And people, they find themselves not knowing what to do, how to handle this whole situation. There are also lots of conflicts that comes, with this. Sometimes, due to the lack also of understanding what hospice is, people find themselves saying, but I thought you are going to put a drip on my mother. Why are you not doing 1, 2, 3? Why are you not doing 1, 2, 3? Because you don't have this information. The information that you were supposed to get from palliative care when we were starting this journey and walking with you until that part when they say, now there's nothing that we can do for you anymore. So I don't know whether it's clear,
It is clear. I'm sitting on thinking we probably put you through that as well. Like because there was some misunderstanding as to what hospice is actually offering.
Yes.
Because there's an idea that even if a loved one is being sent to hospice, there's an idea that it also acts as a hospital. Am I wrong to assume?
If you don't have the information, you are not wrong to assume, because many people, they come also and say, aren't you going to do any blood test? Aren't you going to put up a drip? Aren't you going to take a person for an x-ray? Aren't you going to do a blood transfusion? All those things, because there is no information out there. And my blame go to the doctors who are referring, because they don't give the families that information. Now you come to hospice, we expect that you know what we all do.
Yes. And when you are carrying on with your normal, day-to-day things. Yes.
We usually find ourselves in a position whereby we are taken aback now, and it's like, oh, okay, fine, they don't know. So we need to start and explain. Sometimes families don't even hear when we're explaining, because it's your mother we are talking about. It's your father that we are talking about. You are not going to sit back and accept people saying, no, we are not going to put up any drip. We are not going to do any transfusion. Remember, you have hope. You need the person to be better. We have belief systems. We believe in miracles, some of us. So you believe in all those things. And when the information is not there, then it destroys you as a family member. And many times you find that family members, they don't even want to listen. Many times we have family members who said, I'm taking my mother or my father out of here. There's nothing that you're going to do for my father or my mother. It means you're going to just let them be, sleep there on a bed without doing anything. Granted, they don't know what this care is all about.
Okay. So in summary, hospice care is?
In summary, hospice care is when it's at the end. The care now, you've been told there's nothing that we can do. We are looking at we are not gods. I must just say that we are looking at short term. As you know, Greendale House doesn't admit people for longer periods. It's only 2 weeks.
I was gonna say, can we please tell us how long can a loved one be at hospice? Yes.
Hospice care for 2 weeks.
Yes.
Because it's at the end. We are expecting anything to happen within that period. Like I said, we are not God. So a person can live longer,
Longer, yes, that's
than
correct.
those 2 weeks. But people do come in for symptom control and pain management, and they are discharged back home. Or when the doctor maybe sees that, okay, this person still has months to live, then a person is to be taken to maybe a frail care center or maybe at home to be taken care of in the comfort of their own home. So with Greendale, admission is 2 weeks. That needs to tell you that hospice care towards the end
It's
of
a
life.
short-term
Short-term,
housing
yes, housing
for comfort
for
towards end of
comfort,
year.
symptom control, pain management. Remember, we don't want to see people dying in pain and sometimes with no dignity at all. So we want to retain that
Yeah.
dignity. We want a person to be pain-free and
Comfortable.
and comfortable, and yeah.
I think that was my biggest wish, that if it's not going to be in my home, it has to be somewhere where he is peaceful
Yeah.
and he is taken care of very well, and he's very dignified, you know. And I think I got that very much from hospice. You know, I was obviously I was very sad that my dad passed, but in the way that it happened and how dignified it was, I was hurt, but at least and tutuzela, to say the
Yeah.
least, you know. What emotional or practical support does hospice provide to family caregivers, especially those caring at home?
Hospice. I want us to, not just say hospice, palliative care and hospice care.
So hospice does also offer palliative care, or hospice offers palliative care.
There's hospice care, there's palliative care.
Okay.
Then there's a hospice, which is a center. If you have
Yes.
noticed now, many hospices are rebranding. They are
Yes.
running from the word hospice.
Okay.
Because,
Okay.
hospice, there's a stigma. We must agree, especially here in South Africa,
Around
around
hospice?
hospice. Because when HIV and AIDS was still rife, that's when the hospice movement was introduced
Okay.
in South Africa.
So the
And
stigma is still attached to
yes,
that?
to hospice.
Okay.
So we are rebranding to palliative care
Okay.
centers, of which palliative care, the journey, we walk with you. Hospice care towards the end. Hospice care can be rendered at home in the comfort of the patients, surroundings, family members. And palliative care also can also be done at home. But you must always, at the back of your mind, remember that palliative care is when a person is still going through curative treatment. Let's take an example with cancer. When a person is still going through chemo, palliative care also is being done. But like I said, hospice care is when the chemo, all the treatment that is being done is being stopped now. And they are saying, okay, there's nothing, this chemo is no longer working, this treatment is no longer working, there's nothing more that we can do than hospice care. So coming back to taking care of the patients at home, hospice care is also done at home. Remember, it's let's say a patient's wish or a family's wish to say, you know what, I don't want my family member to be taken care by strangers that I don't know, in the environment that they don't know. I need them to be at home next to us as family members. Then the care team will come and offer hospice care at home. Yes, they still die with dignity, comfortable, and all that at the comfort of their own home. Now, with hospice care, when it's done at home, we need you as a family member, because now we must teach you how to take care of your loved one. Remember, as a care team, we are not there 24/7 with you. We just educate you to say, if you see this, then do that. If, make sure also the setup of the room, is it comfortable? Bedding, do you need hospital bed? All those things come into play. And emotional support, we have our counselors who come at home and give a counseling. But I must say this, people, they often reject counseling.
Okay.
I think.
Why do you think
from
that is?
from my experience, people feel like when they are sitting down with a counselor, they feel that now it means we are weak.
Okay.
Yeah, it means we are not strong enough to handle this. It means we are useless. And it's not like that. Remember, you are going through a lot as a family member. It's not easy to see your parent changing from what you
are used to.
know,
Yeah.
you know what?
Yeah.
You know what? Now you are seeing this person that you don't know. Let's go back to dementia. Remember, a person used to go to work, knows all of you. All of a sudden, a person cannot go to the bathroom by themselves.
Correct.
A person can't even remember the family members around them. The person can't even remember the room.
The environment,
that
yeah.
you know what?
I think on the topic of a counselor or those because I asked what emotional or practical support does hospice provide to family caregivers, especially those that are caring for people at home. Something like a counselor or someone coming in to basically support the family, in that regard. It's also not easy to talk about how you're feeling during that time. So it's giving them that little bit of grace to say, I understand it's not easy to talk about your emotions because we also don't understand what's going on.
Yeah.
So I can't tell you what I'm going through when I don't understand what I'm going through.
Yes.
And it also feels as though I don't have time to be talking about my feelings because the time that I'm sitting down here and having a conversation with you, I could be doing something else for the patient. So I think it's also if the counselors could approach them in that manner, and say, we understand that you also don't understand what's going on. You are learning it every day of your life. I'm just here to support you. If it's coming across as that and not coming across as, okay,
Tell me how you feel. Like,
I don't have time,
you
ma'am.
know what, you know,
Like,
yeah,
thank
true.
you, ma'am.
Yeah. We have devised a way now, seeing that people are not accepting counseling. When now we do visits at home, it's me, the doctor, maybe the counselor if I'm not available, and the home care sister. We are there as the IDT team, and I will sit there and be introduced. Okay, this is Penny, the social worker and the counselor. This is part of the service that we offer. And we leave you with an option to say, okay, fine, there was a counselor who came through. And if I need to talk to someone, I know, And I will also have some few words with you, in the midst of everything, when the doctor and the nurses talking to you, maybe educating and all that, so that, I open the door. And when I'm gone, if you realize that, you know what, I need this service, then you are able to call us. Unlike, there's counseling, come, we need to talk to you. Like,
That is
excuse
correct.
me,
That's correct.
I'm going through a lot now.
Yes. There's a way of doing it, or there's a way in introducing it to the family so that they're also more welcoming and they're also warm to the idea that this service is actually available to them. Because I think it's an amazing, service to offer to families that are going through that. And some families don't think that they might not think that they need it at that time.
Yeah.
But once it actually happens or they start going through these sessions, they actually see that they need it, How do hospice teams help families maintain dignity and comfort for someone living with dementia?
You know what? When it comes to a person living with dementia, we need to be guided by you, family members.
Okay.
We will not be able to come with I will say, top-down
Yes.
approach to say to you, remove this here. This is how you must do things, and remember, we are not the ones who are staying there with the patient. Is you. We will guide you. Maybe, as I will make an example, we know that in most patients with dementia, they are afraid of mirrors.
Oh, really? I didn't know that. And why do you think that is?
Most of the time, when they see their reflection in the mirror, remember, they no longer even recognize themselves.
So, okay.
Others, they even break that mirror because it's like, who is this someone? This person is trying to attack me. Others, they will stand in the mirror and talk to the person that they are seeing there in the mirror because they don't recognize that it's them. So we will just guide you. Oh, we see that in this bedroom you have lots of mirrors. Maybe try to, close them if you can't remove them. And sometimes, if you, I will make an example. This very tree here,
Yeah.
sometimes it can be very frightening for the patient. Black carpets on the floor. They might think, I'm going to fall through a hole. Remember, their mental state has changed. You can put teddy bear there. They will think this is an animal that is here to attack me. That's when we are going to guide you to say, listen, yeah, we see your room is very much beautiful, but we think you might consider changing this carpet because maybe of the color, or maybe the patient might trip and fall. Consider removing those mirrors. That sometimes in other houses they have maybe a jacket that is already always there. This might frighten the patient. Maybe the TV sometimes in the room. That's why I say we are guided by you. We will only be able to say, maybe if you can move this here and there, here and there. Remember, another things are suggestions that we will make depending on the patient. Remember, the patients are not the same. I will make
That's correct,
an example with, by the way, my mother had a dementia too. When there was noise, like we will come as her children and make noise, and she'll become very agitated. So we knew that when she started to be that agitated, we need to reduce the noise. We need to go out, some of us, and leave her there. So we will have to, we ask you, how is your mother or father in front of other people? And then you'll tell us, no, she loves people. Then, okay, it's fine. No, she becomes agitated when there are lots of people. Then we will be guiding you. Make sure that you don't allow like 100 people to come in the room.
Because it disorientates them.
Yes, and also about dignity. Usually when the person, mentally they're no longer okay, your family member from KZN will come and look at your mother or your father and say, she's now crazy, like in front of them. And sometimes they will even start treating them like a baby. Oh, no, 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 no. No.
It's embarrassing.
It's embarrassing. And sometimes, like I said, the patients are not the same. Others will even take out their clothes, expose themselves. So you need to make sure that you protect the patient from all of that. Like, make sure that before a person comes in, the patient is covered, those things. We guide you, we are guided by you in order for the patient to be comfortable and to retain the dignity of the patient. It's okay. I always say to family members, it's okay when you feel that these visitors are becoming too many here, to say, no guys, you know what, because my mother or my father becomes very agitated, it's okay to call. We will tell you how they are. But if you come here and then you unsettle the whole thing, then no.
Yeah. In on the topic of dignity, I remember when we were still trying to figure out the whole situation, and Utata being at home and everything, what we noticed was that he used to fall off the bed, and we didn't understand what what caused that, you know. And then because your cognitive decline affects your mobility, right? But only after doing research, that's when I started to understand that's probably what is happening. Your original state, right, or your normal state says I can walk,
True.
but then your brain is not connecting with your body.
Yeah.
So then, those type of things happen. So what we then eventually did is we had to lower the bed so that it's not too high.
Yeah.
And obviously with him, when we do find him on the floor in the morning, he's embarrassed, And the one thing that we tried to do was to not act like it's an issue. It's let's try and help you out. And we noticed that, we lowered the bed, and then that was that. So now in the morning he could, just call out and say, I'm ready to get out of bed. Or if he's trying to get out of bed, he's literally touching the floor. So it's not a big thing. So things like that from when I remember how we tried to make the situation or the environment and the space more dignified for him. Those are one of the things.
Yeah.
And then also coming into terms with the incontinence product, as much as it was new to us, it was new to him as well. So those moments where you try and be more friendlier about it, and act like it's normal. It's not a thing. You are fine. You actually see a better response from them because you are so sensitive about the actual thing that is happening, And what was also lovely was the room was very close to the bathroom. So you didn't have to walk too long to get to the bathroom. So those type of things, you might think they are little things, but they're actually really huge for someone who is immobile and they cannot get there, and then incontinence, starts to occur and you don't know, what to do with yourself. And maybe you can't even communicate it, because now the people around you are not familiar. You don't know who to communicate with. Who are they? Because they're not wearing nurse uniforms, So on that topic of dignity, that's what we tried to afford my father, during that time.
And you did great.
Thank you.
Yeah, you did great.
Thank you
like
so
I
much.
said, we are guided by the family. See how the changes you made,
Yes.
made a very big difference.
Yes, that's what I'm saying. It might seem small, but it's really big for him. Because at that, you're still a human being. So you still want to be treated with love, and you still want to be treated as a human being.
Yes.
It's very important.
And if I can also add this to people out there who have family members with dementia, I always say it's very much important to play along.
Yeah.
Remember, sometimes they don't even remember who you are. My mother used to call me her sister. Her sister, who has passed on, by the way. Yeah. Whenever I walked through the door, she will say, Doreen, sis Wami. And it's hurting. Yeah. I wanted my mother to remember me. I wanted my mother to recognize me. That I'm not her sister, I'm her daughter. But because, I understood.
Have to meet them where they are.
Oh, my goodness, I will play along. Sissy, are you good? But I was dying inside. Listen, offense, we cannot sit here and pretend
that it doesn't hurt. No, it does.
Yeah,
it does.
It does. So, for people out there, they really need to be aware of all these things.
Yes, they do. And on my first season, I remember sharing that my dad thought I was one of the patients in my house. And I played along. And he would be like, Ulapa now. I'm like, when I'm dilap. And it was fine.
Yeah.
You just play along to it because you are trying to make someone comfortable. Yeah. Because also saying, if you had said to your mom, no, I'm your daughter. Now it's switching her brain into trying to even remember, which can cause so much frustration. Yes. And then it can cause insecurity, and then they just close up.
Yeah.
you know?
Maybe she sees herself as a 15-year-old, and here's a grown-up woman coming and saying,
I'm your
I'm your
daughter.
daughter. Where do you come from? I
Thank you
know we
so
are
much.
laughing, but yeah.
Let's move on right on to the next one. What are some of the common fears or misconceptions you hear from families, and how do you guide them through those moments?
You know what? Let me start about the misconception of, especially for pain control. Hospice palliative care, morphine is used a lot
Okay.
because it's a cheaper option, when it comes to pain control medication. So people think that when
How
they
safe is it?
100% safe. There's no roof for a morphine.
Okay.
There's no, depending on the pain, there's no overdose when
Okay.
it comes to morphine. So people are scared of morphine. Whenever they come to hospices, like, are you going to give
Our parents.
morphine? No, don't do that. And we need to sit down and educate them. This is one of the misconception. Another one, they think that yes, it's end of life.
Yeah.
We are going to hasten death.
By morphine.
Like we
By
the
offering
hospice
morphine.
team, we are team,
Oh,
we are
oh,
going
oh,
to
oh.
actually hasten. We are going to kill the patient. We have means to make the patient to die quicker. Yeah. Others, they will even come and ask for it and say, oh, now we are happy. Our mother is here. It means by tomorrow she will be dead. Because it's the misconception out there that, okay, hospice care, end of life, they will hasten death.
Oh,
It
wow.
will happen like now. Others, they do get frustrated when they see that, okay, hospice, you said you are admitting for 2 weeks, but now we are going to day number 9. What's happening here? Aren't you, why are you not doing your job? So it's
Wow.
one of the misconceptions about hospice. And another one, remember we said when the hospice movement was introduced in South Africa, it was that time where HIV and AIDS was still rife. So it's like, no, you are not taking my parent to hospice. What are our neighbors going to say? When they hear that my mother is admitted at hospice, they will think my mother was HIV positive. No. So we constantly need to
It's a
educate.
very huge stigma.
Yeah. And also, many hospices, the cars are branded.
Okay.
Go to the home visit with a branded car. Other people, they won't even allow you, because now it's like you are disclosing to the whole neighborhood that there is someone who's sick here. So yeah, those are some like of the misconceptions that for me I feel people need education
About
yeah,
about palliative care.
palliative care and hospice care.
Yeah. Okay. So for families grieving or adjusting after their loved one passing, what continued support does hospice offer?
Hospice has loss, grief, and bereavement groups. If a person does not want to be part of the group, we are not the same. Other people are not comfortable in a group context. We do one-on-one loss and bereavement
Amazing. I didn't know
counseling.
that.
Yeah. Yeah, is there. That's the support, because we believe that with dementia, we are talking about dementia here, you lose a person while they're still alive.
That is correct. That is 100% correct. I remember saying this to a friend of mine, and they just didn't understand what I was saying. I was like, I mourned my father while he was still alive.
Yeah.
Because it was not him anymore.
Yeah.
So, yes, you may
The
continue.
anticipatory grief there is, it's something else.
Yeah.
You know, one day the person is going to die, and this person is no longer the father, the mother that I know.
Yeah.
And after the loss, grief, grief becomes complicated because now they are gone. Now you're dealing with this loss that has happened. Physically, they are no longer here.
Now they are no longer
Yeah.
yeah.
So
yeah.
you are dealing now with all those emotions, and sometimes the regrets. Maybe I don't think I treated them okay. I was supposed to do this instead of that.
Yeah.
Why didn't I take them to hospice? Why did I keep them home? Why? All these questions without answers, they will attack you after they are gone and buried. So we do have that support system at hospice whereby we walk. I call it walking the journey. This is a journey. Doesn't end when the person dies.
Yeah.
It continues.
Yeah.
I always say, remember, we also have these grief triggers,
Yes.
these triggers. And the person, you will say, okay, my father had dementia, okay, he's at a better place, and then there comes a man wearing the same jersey that your father used to have. That's a trigger. Birthdays, anniversaries, those are triggers. So it's a journey. That's why, I call it a journey. You need to walk this journey. Even after 5 years, the pain comes back. And people will say, you are not normal when your father died 5 years ago. Why are you crying now? It's because there was this trigger and you kind of remembered things and you become emotional. So it's a journey. The message that I want to put out there is that it is a journey.
That is correct. Okay, so in summary then, we can say that hospice is there to not only offer end of life services, but they offer palliative care.
Yes.
And they do also offer home visits and counseling. Is there anything else that
And
you would like
inpatient
you'd like people to know?
I would like people to know that hospice and palliative care, it's about holistic care.
Okay.
We take care of the person's physical, emotional, psychosocial, and psychological.
Okay.
So, and spiritual. Hoping maybe one of the good days you'll call me and we talk about this holistic care, because people don't understand when we also talk about spiritual. Ningenapi is hospice. Remember, a person is approaching the end of their life, so there's lots of things
That are
which
happening.
are happening in their life. So hospice is a holistic care. And thank you so much.
Thank you, Dr. Penny, for bringing so much light to a topic many people shy away from. I hope this conversation helps families see hospice not as the end, but as a way of honoring life with love and dignity. As we close the season of Dementia Unpacked, I invite you to keep these stories close, to talk, to plan, and to remember that making dementia normal starts with compassion. And if this episode resonated with you or a loved one, please share, like, and subscribe. And thank you so much. We will see you in the new year of 2026, where we continue making whispers about dementia normal. Thank you so much.